Hello and welcome to this week's What Were They Thinking? Among the news items we have for you this week is the second anniversary of the CCP virus. A vaccine that could be effective for many people where we are currently limited to certain financially successful countries. The revocation of a medical license in California for a doctor who's been running afoul of the exemptions for various vaccines. The impact of various mutations on the reputability and efficacy of antigen testing. An interesting throwback that proves vaccine passports, if you so wish to call them that, isn't a new concept, but has in fact existed a long ways back. These and other news items will be covered at the timestamps given below. Let's start with this year's anniversary. Roughly 2 years ago, China began reporting on an unusual case of pneumonia. That pneumonia is what we now know as the CCP virus, COVID-19, and various other specific names for it. 2 years ago, and we are still seeing the effects of it carry through to today. In fact, Florida may be seeing it very hard. They now have record high numbers of new cases. Understand, at this stage, a high case count isn't necessarily the worst thing if it's corresponding to a high incidence of vaccinations. That would mean that yes, more people are infected, but fewer are going to have extreme infections that are going to cause more complications, death, or require hospitalizations. Florida's new record is 32,850 new cases in one day. That's a really high number. Horribly high number. More so for the fact that Florida is especially attractive to the elderly and those who often have comorbidities. They go there over the winter period to escape the cold. Having an extremely high case count would mean higher exposure and greater risk for those elderly individuals who have now gone there. That sudden rise is also coupled with the seasonal change. Winter was always going to have a higher case count with more people inside for longer periods with greater proximity to each other. This means more infections, more easily and more frequently. This will inevitably lead to more incidents related to infection. One example here is more interesting than others. It was the issue regarding testicular artery thrombosis, that is a blood clot in the testicles. This would cause hypoxia and possibly death to tissue within the testicles. The reason for it? The CCP virus and the consequential hypercoagulability from that disease. Hypercoagulability meaning the blood clots more freely. The issue here is not exactly what happened. It is something that does occur outside of diseases like this. For example, violent force, sports, twisting, physical activity, let's say. Things like this can cause thromboses. The COVID-19 virus itself does increase the risk of thrombosis. And so, the more infections you have, the more of these sorts of unusual presentations you are going to see. The way it's removed is going to vary based on how bad it was and how accessible it could be. Sometimes simply using anticoagulants will do the job. Other times, surgical intervention is required. It seems like this particular case led to an ischemic or damaged testicle that had to be removed. That means there's likely to be no children as a result of the testicle being removed. One of the ways that this can be reduced, if not entirely removed as a possibility, is vaccinations. And in this instance, there's been a new vaccine again that has been approved in India. It's called Corbevax. It is a vaccine that is much cheaper to produce and is going to be more readily available. We mentioned how more financially secure countries, or those that are better developed, like say America, European countries, and so on, can all afford vaccines or have their own major pharmaceutical companies that are making the vaccines domestically and thereby reducing overheads. Something like Corbevax is going to make it far easier for other countries that don't necessarily have the same sort of infrastructure and companies, or have not yet developed their own vaccine, be able to do so. It was developed by the Texas Children's Hospital and the Baylor College of Medicine. Unlike just about every other vaccine that's currently available, this was not funded from governments and similar, giving companies huge amounts of cash to streamline the process and facilitate clinical trials. This was all fundamentally funded in-house by those two groups. Further to that, the vaccine itself has been licensed without any patents or other conditions to Biological E Limited. This is a major vaccine manufacturer over in India. They're hoping to be able to produce 100 million doses a month from February onwards. Unlike some of the other vaccines which were published very early on, this one is easier to produce, relatively easier to store, can be effective, if not as effective as the others, is inexpensive, and is suitable for low and middle income countries. This means it's going to be very attractive for those resource-poor countries that need to get vaccines out on a large scale and have yet to get their doses through COVAX. The advantages of Corbevax, unlike the others which use mRNA technology, is that this is built on basic technology that's been used for years. Historically, it was things like eggs, but since then we've moved on to things like yeast. And this means that countries that don't have a lot of money can still use very simple, very reliable, and very well-known techniques to produce vaccines as they need to domestically. This will bring those countries in line with most of the developed countries that have a largely vaccinated population. The developed nations still have their own problem, especially when it comes to vaccine hesitancy, anti-vaxxers, and similar. Some people are pushing hard to find any loophole to get around the issues of being vaccinated. Most of these are because they're stupid. Some of them have legitimate reasons not to be vaccinated. Issues around medical conditions, immunity, allergies to certain ingredients, and so on. And those individuals, it makes sense not to vaccinate. Then there is the rest. And the rest is where the problem lies, especially in California. It seems like once you get a certain amount of money, you no longer give a crap about medical care and think you know best. It is unfortunate that some of the most wealthy people in America can be found in California, and California is also a fortress of the ignorant anti-vaxxer cohorts. This is where one doctor, Dr. Mary Kelly Sutton, has now had her medical license revoked. She was fundamentally facilitating avoidance for vaccines to these same people. She did so by issuing fake vaccine exemptions. To defend herself from the allegations brought against her at the medical board, the former good doctor bought a homeopath who has no medical qualifications, a neurology and pediatric specialist who believes that there is a link between vaccines and autism, despite it having been well and truly debunked, and a integrative specialist who is, surprisingly, a doctor, but has also been fined for breaking various health codes in Michigan. So, yeah, not exactly a stellar repertoire of experts to defend yourself with. That self-same lack of quality evidence to support her case and lack of medical expertise is why she lost her case and has now had her license revoked. Further to the simple fact that she was issuing a whole bunch of exemptions to children, While it is true that some degree of skepticism and hesitancy is understandable when it comes to children, the majority of the arguments relate to either vaccines cause autism, which is untrue, vaccines are unproven, which is even more untrue, or that the vaccines haven't been approved, which is untrue. The one argument that has at least a small amount of evidence is that the vaccines were causing issues to do with inflammation and immunology in children. Specifically, it was something called multi-system inflammatory syndrome in children, or MIS-C. This is a very serious condition and complication at that. It isn't just limited to vaccines and is more commonly seen as a result of infection with the CCP virus. This means that vaccinating children protects them from it. And that's the key to this most recent study. It's a French-based study that looked at the various data available through the French Public Health Agency. It looked at children 12 years and older and whether or not they were given the vaccine between September and October 2021. The simple conclusion is that there is a substantially lower association between inflammation for this condition and vaccinations. That means the vaccines protect from a serious and severe complication of infection with the CCP virus. Exactly the same sort of pattern we see with it across the board. Vaccines prevent serious infection and complications. It's really simple, and we're really sick of having to repeat the same information. Hopefully, if we repeat it enough, we'll drill it into someone's head eventually. Moving slightly away from just the issues around vaccines, but to testing. It is possible that with the newest Omicron variant, the reasonably commonly used rapid antigen testing kits for home may be giving more false negatives than previously thought. It is true that it isn't the most reliable test kit if you're using it at home. That's because many home-based kits aren't necessarily transported, stored, or used correctly. This means that their accuracy will go down. Once you begin seeing those sorts of things, you can view them as more of a good guide, but not a diagnostic system. It means if you think, I'm feeling unwell, maybe I should have this checked out, and you live in America where healthcare costs a fortune, it makes sense to buy a test kit instead of seeing a doctor. If you live in a country where healthcare is accessible and will not require that you sell a kidney, you can just see the doctor and get a PCR test done. You will have lower sensitivity, which means you'll need a stronger expression of Omicron variant in whatever you're using as the sample for it. But you can, for sure, use it and be able to get a response, or at least should be able to get a response. If you don't have enough secretion of the various antigens that are being made by the Omicron variant, that's where you're going to have some concerns. Despite this, the FDA has said that it will continue to authorize the use of such antigen test kits because they do still work and they will still detect surface proteins from the CCP virus. It's just something to be aware of. The final bit of news this week is not so much news, but an interesting picture we came across. In fact, two of them. They're throwbacks to a long time ago where there were diseases that were far more endemic and far more of a problem than the CCP virus. Specifically, polio. Polio is of course a disease that we have effectively eradicated from just about every developed country. You can see here how different people were getting vaccine cards to be able to demonstrate that yes, they had been treated for a very serious disease and were, as a consequence, immune to it. While it's true that the different dates on these demonstrate a very long period in which this was being done, the issue isn't whether or not they were being done. The issue is to point out that people have been using vaccination records like this to prove that they have immunity to various diseases for at least 130 years. Going from people's paranoia about various different choices by the government to record their medical history to a somewhat more weird and offbeat cure-all that's currently being marketed: colloidal silver. Colloidal silver is one of the weirder things you could try and sell. Why Candace Owens might be trying to sell it or at least support its use has us at a bit of a loss. You'll easily be able to tell who has and has not been following this advice by seeing whether or not their skin is beginning to turn Smurf blue. That is one of the side effects of taking colloidal silver. While it is true that things like silver and other metals do have certain antibiotic properties, those properties are because they are a reactive metal. This helps to damage bacteria and other pathogens, thereby reducing the number of them that will survive and increasing the immune system's ability to curtail the spread of the pathogen. Taking it as an oral medication, not so much. It's not going to work for a variety of reasons, but perhaps the biggest would be that it's going to hit the bacteria and other possible pathogens in your GI tract first, which will hurt your immune system, then be absorbed into your blood, go to your liver, where it may cause even more damage, before finally entering systemic circulation, and then beginning the pony show of whatever else it's going to hit along the way. Owens herself explained that she takes a teaspoon a day and more when she is sick, which seems more like a bad idea than something you should be trying to emulate. Your body's already trying to deal with whatever's making you feel sick, and you're now giving it a metal it needs to clear out and get rid of on top of whatever's making you ill. You're just giving it more work to do when you're already out of sorts. Yeah. Going from the various crazy ideas out there to a more immediate and somewhat pressing problem. The amount of blood available for transfusions and similar in America has gone down drastically over the last 2 years. There are a variety of reasons for this, but the ever-shrinking supply can be distilled down to just a few things. One of which is simply, supply chains are being strangled by the lack of movement of trucks and similar. This means that you are unlikely to be able to get blood being moved from areas of high supply to low supply. The other issue is going to be the lack of healthy donors, that is, people who qualify to donate blood at any given time. If you don't have enough people giving blood, it doesn't really matter if you can move it from one place to another. It's simply not there to be moved in the first instance. This is a big issue. Blood is one of those things that is essential, especially around Christmas. The Christmas-New Year period is when blood is in high demand due to a variety of things. One of the simplest is that more people are sick, traveling, and unable to donate. There's also an increase in the number of people who require blood transfusions. The reason for that is many-fold, but things like increased number of accidents, a higher incidence of suicide, and so on will increase demand that way. Because of this, America now has one of its lowest supplies ever, and this is a big issue. If we go instead from just the practical problems of being able to get blood and move it, there's also a shortage of staff who can then deal with the blood, test it, and do the other things that are necessary to make it possible for blood to be used properly, effectively, and safely. The lack of staff, partially due to pandemic restrictions and more, means that places like the Red Cross in America are unable to do what they need to do to make sure blood is safe and can be effectively transfused without risking various diseases. Imagine if you get a blood transfusion, you might be incredibly thankful that you've survived whatever needed it. You'd probably be a lot less thankful that you've survived if you acquire unfortunate diseases like prion disease, HIV, and more that can all be transfused in the same blood. The final news item we have for you this week is, thankfully, far more optimistic and positive. At least for now. The James Webb Space Telescope has successfully launched and has begun deploying itself in space. This is the newest space telescope being deployed by NASA, and takes over many of the roles that things like Hubble have been performing. While it does have a very different setup and arrangement to Hubble, it's also able to do a lot more because of that. Where Hubble is an entirely optical telescope, this uses a different mechanism, and by doing so, it can see further and in higher resolution. Unlike Hubble, it's also made as something of an origami package. Various parts will move as needed to deploy it in the right place in space, and it will begin deploying as it travels to the L2 location, which is an orbit where it's going to have the maximum ability to see out into space, whilst also being close enough to Earth to be able to transmit back large amounts of data every day. In case you are unaware, one of the huge advantages to this telescope over others is the sheer size of it. Hubble, which is our current biggest telescope in space, has a lens size of 2.4 meters or roughly 8 feet. This has a lens size that's going to effectively equal 6.5 meters or 21 feet. A 3 times increase. And again, all of this is able to be deployed in a single rocket and go into space effectively because of the way it's going to unfold itself once it gets to where it needs to be, and various other parts deploying along the way. That's all the news we have for you this week. Thank you for watching. If you have found it interesting, consider liking, sharing, and subscribing. Please post any comments, questions, or suggestions that you have below.